Today on Travers Talks, we're joined by Sarah Lee Sullivan, Executive Director with NAMI Grand Traverse and one of the leaders behind a bold new proposal, the Northern Michigan Mental Health Campus. This regional project aims to bring inpatient, residential, and treatment services closer to home for families across northern Michigan who now must travel hours for psychiatric care. With no youth beds available in the region and adult facilities stretched beyond capacity, the need has never been greater. We'll talk about the plan's vision, location, and cost, and how community collaboration could make it a reality. Stay tuned as we explore what this campus could mean for mental health care in northern Michigan.
Sarah, welcome to the show. I'm glad you're here, and I think we've got a great topic to discuss and an extremely important topic to discuss. How you doing?
I'm doing great. I'm happy to see the sun shining.
Yeah, Traverse City is gearing itself up for winter, isn't it? Yeah. The tree leaves are starting. Yeah, the tree leaves are starting to fall, and everybody's getting out their winter jackets. Anyway, we've got Sarah here today to talk about really a very important proposal and really one that needs urgent attention, and we want to bring everybody's attention to it in the northern Michigan area. And it's all about psychiatric care, as Cassidy said in the intro. And Sarah, when we look at psychiatric care in northern Michigan, what do families face today when a loved one or somebody, a friend, loved one, or whatever needs urgent psychiatric care today? What happens?
Yeah, it's pretty scarce in terms of resources, and oftentimes folks will go to the emergency department because they're open 24 hours, and instinctively that's where we think we should go. But other times, if folks are out on the streets, they end up in jail, which turn into de facto hospitals of holding folks until we can get them to the proper mental health facility for their care. There's just a lot of gaps here in terms of the different levels of services that folks need, and then directing them on where to find it.
Yeah, and the population has grown dramatically here in northern Michigan. If you look out at, obviously, Traverse City has grown and so forth. And what you're really telling me is the psychiatric care hasn't really kept up with the population growth, has it?
I would say no, not specifically within our region. And there is some data that supports this. Recently, there was a study put out by MDHHS concerning the number of inpatient psychiatric beds throughout the state, and specifically for our region, which is coded as Health Service Area or HSA 7. We have only 50 in-service adult inpatient beds to serve a population of 500,000 people, and that is across the northern Michigan region. And we have no beds available for psychiatric use for youth. So that is an alarming factor.
Yeah, let's talk about one of the things the plan highlights is the 0 youth inpatient beds in the region. We have none. It's like mental health or a mental situation doesn't affect our children. It's crazy, and what does that mean for the local kids in crisis? What happens to a kid? Let's say he's 10 or 12 years old and he has an emotional breakdown, anxiety, he's getting bullied at school. Where do they go?
Yeah, and that's the heartbreaking part. We wish that kids didn't have mental health issues, but that's not the reality. And now in this case, we do have availability with the Crisis and Access Center that was opened up within the past year. And so that does allow for youth and families to be able to access resources to further aid in their care. But oftentimes what happens with families is that they end up transporting to further communities. So, for example, Pine Rest is a facility in Grand Rapids that can accept youth, but families may also be faced with traveling to Detroit or to facilities up in the UP. And that's a really hard strain for parents that are working, that may have other children or other obligations at home, to now send their child far away and not be there to help aid in their recovery.
You mentioned Pine Rest, and there's another psychiatric unit called Rogers Behavioral Health. And apparently it's a step down, and you guys are modeling after that, aren't you? Why don't you explain that a little bit to the audience?
Yeah, so the Northern Michigan Mental Health Campus, it is modeled on facilities such as Pine Rest and Rogers Behavioral Health, which is located in Wisconsin. And it really calls for what we consider the full continuum of care. We see this a lot in models for substance use disorder, where folks have the ability to start with more intensive inpatient treatment and then gradually step down into maybe residential care while they're reintegrating into the community. And then eventually they can step down to outpatient care. So it's a really nice way to stabilize patients versus what we're dealing with now. If an individual has a crisis, they go to the emergency department. They could be boarded there for 7 days, which is a very chaotic environment in and of itself. It's not fitted for behavioral urgent care. And at this stage, folks may be treated for a week and then released and have no follow-up care. And it begins this vicious cycle that it continues over and over.
Yeah, and I was just thinking because we've got a crisis now in the government shutdown for healthcare subsidies and so forth. And one of the things I was thinking about, if a family has to go to an emergency, let's say they go to a Munson's emergency facility, that's expensive. But the most expensive treatment possible is an emergency room. And so that's where we're bringing our psychiatric patients, and they should be treated elsewhere because it's not going to be the proper kind of care. Not that Munson would ignore them or anything like that, but they're not really trained to do that. You guys decided on Kalkaska. I know a little bit about Kalkaska, but you've identified that as the ideal site. How did you determine that?
So Kalkaska County is really centrally located for the northern lower part of Michigan. It is accessible from the UP down 75. It's also close to major hubs of Cadillac and Traverse City and Petoskey. You're within an hour or less distance from those major cities. And so we felt that the location surrounding Kalkaska County would be most accessible for folks, but also attract the families and the staff that we will need to get the facility up and running.
And thinking about the facility, here's the big nut. The project is estimated at about $37 million. Mm-hmm. So how do you see the mix? How do you see the funding? State, private, or I know it's going to be all three, state, private, and philanthropic. How do you see the mix going forward?
Yeah, I mean, we're looking at a combination of state funding, private funding, and then foundations. Primarily, we are asking the state to step up in this matter. And in the past, the state has funded over 22,000 psychiatric beds, and over the decades that has declined. And we owe it to our community at large throughout the state to have these services available. And that's why we're really pushing our state legislators for support to be able to help us fund this project.
And I did a little podcast that it's going to go on tomorrow, and it really highlights some of the issues we're having with workforce housing and so forth, and workforces. And I know the medical facilities get strained. And you guys are going to partner with NMC and CMU, is that correct? And you're going to work on building those relationships and getting people up here. Is that the idea for the workforce needed for Kalkaska?
I sure hope so. So this project is a co-collaboration of several individuals. The workforce piece is actually one that I have dove into extensively. There are lots of different options and ways that we can attract qualified staff. And one of those is to partner with local colleges, but also some of the bigger universities to create a teaching environment. And it also allows us to build up the general workforce, because the mental health workforce is not as robust as it can be to meet patient demand. But then it also gives us the ability to train different levels of positions because we will need everything from psychiatrists, psychologists, nurse practitioners, nurses, social workers, the whole collective that goes into operating a mental health campus. So I do hope that through clinical training, tuition reimbursements, stipends for internships, that we're able to build some connections with the local universities.
Yeah, we've got a good we've got NMC here, and obviously we've always been able to draw on Michigan State and the University of Michigan, and we got a great center of education here, just getting the people up here. It's not that bad anymore, people. The winters are milder than they used to be. Don't be afraid of the snow. It's a great place to live, a great recreation area. So when you look beyond patient care, what do you think the broader benefits, economic, social, or public safety, could the campus bring to Northern Michigan? What are your thoughts on that?
Sure. I think it has economic benefits for attracting more families, more jobs here. I think it provides benefits in terms of safety in our community. We experienced a pretty tragic event last summer that, if we had the proper mental health services and mechanisms in place, could have been entirely prevented. I think we also will relieve some pressure from our hospital systems that are triaging the mental health crises through their emergency departments. So there are many facets for how this type of a project can have a positive impact on all aspects of our society.
And I know when you're talking about the terrible situation at Walmart, I would imagine, and there was a case, he dropped through the cracks, got off his meds or whatever happened, and he was just left on his own. And this is the kind of thing that happens. So
that's exactly right. Yeah. And it happens more often than we may even know or care to acknowledge, because an individual who is being put in and out of the system continually, whether it's emergency departments or maybe they get to spend a month or two in a psychiatric facility, but then are released again. Like, there's no consistency in their level of care. And that's how they, quote, as you said, fall through the cracks. And we can do better than that.
Yeah, I think, unfortunately, our society doesn't see mental illness as the same kind of illness as cancer or heart disease or so forth. And that's unfortunate, really unfortunate. So what do you want to tell the listeners? Obviously, you're going to be looking at some point in time for donations, and how do you want them to keep tracking this funding request and so forth?
Absolutely. No, I appreciate that, and any support from our community for citizens being able to share your stories about your experiences with the mental health system, attending public meetings, contacting your state legislators. We have a petition right now on our Facebook page for NAMI Grand Traverse to support, and it takes 2 seconds and it's free to just sign your name digitally to support this project. We ask our fellow nonprofits to help join and create a task force so that we can coordinate our advocacy efforts and begin to piece together the steps on how we're going to advance the project forward. And then also for our elected officials to please prioritize this. We're seeing the impact time and again of how neglecting mental health is affecting everyone. It's creating elevated stress. It's putting a strain on our civil servant resources. And it's really time that we put our effort and focus on addressing the system and repairing it.
What's the webpage address for NAMI?
Sure. It's www.namigt.org.
Very easy. www.nami.org. That's pretty.
No, NAMIGT.
Oh,
it's NAMI.
I'm sorry, NAMI GT. I'll put that in the show notes. There we go. So you folks it didn't roll off my lips the way I thought it would. Anyway, Sarah, I want to thank you very much for coming on the program. It was really great. Let's get behind this effort, folks. It's really necessary. And we've seen in the past what can happen when we don't pay attention to mental illness. We've got to treat it the same as we do cancer, heart disease, or anything else. And it's sometimes even more important. Anyway, Sarah, take care and have yourself a great rest of the day.
Thanks. You too, Jim.